Welcome back. I am back again, and I have a special guest joining me this evening. I have Dr. Selma joining me this evening. Dr. Selma is an acupuncturist. She also owns a medicine clinic outside of Chicago. We're going to be getting into some of her life story, and we're going to talk about how she always knew she wanted to be a business owner at the age of 11. So, hello, Dr. Selma, welcome.
Hi, thank you so much for having me. I'm glad I'm here.
All right. Can you turn your sound up a little bit, please?
I will. Hold on 1 second. Can you hear me now?
Yeah, yeah.
Is that
All
better?
right. So,
Good.
yeah, that's better. All right. So, an acupuncturist. Can you tell us a little bit about what an acupuncturist is?
An acupuncture is basically someone who in a different where it's Eastern medicine, basically. Whereas we use tiny acupuncture needles, stainless steel needles, and we use those to puncture the skin, but it's not like a hypothermic needle. So it's not like we're putting any fluid in the body or taking any fluid out of the body. It's just a solid stainless steel needle. And we're basically just changing the way how the body heals itself. I know Harvard did a study, and basically what they did is they had people receive acupuncture and an MRI, and every single person had the exact same outcome, to whereas their brain would start to light up in areas once the acupuncture needles went in. So we do know somehow it is working on the brain level. We know that it works on the nervous system level, and we also know that it works on the blood level. So they think that all three of these things together are somehow triggering the body to heal itself, and that's what we've been doing with acupuncture, I guess, for over 3,000 years. So
Okay, and so you said it lights up the brain. So when you do the acupuncture with the needles, is there something that you're trying to see on the brain?
well, no,
And
we
if so, what is it exactly?
yeah. So no, what it is it's basically changing the way how the brain is working. So the longer that you are ill, the more the brain views it as normal. And our bodies are meant to heal itself, but if you've had something for a long time, then the brain has moved on to something else, and it's not really thinking about healing that what's going on. So we kind of like trigger the brain and let the brain know that what's going on in the body isn't normal, and that it needs to kind of wake up, because our brains are probably more powerful than we'll ever be able to study. But we want to wake up the brain and let the brain know that what's going on isn't normal, and that it needs to kind of kick in to help heal the body.
Okay. All right. And then you said you studied like over in China for several years. Now
Yeah.
I was wondering, was the like as far as like the educational system, was it a little bit more different? Was there like more like opportunity scholarships? Is that why you studied over in China?
Well, what so I graduated in Chicago at the Midwest College of Oriental Medicine. So I graduated from there, and that's where I received my master's degree. Then 2 days after graduating, that's when I went to China, and that's where I received my doctorate. So the first time I was there was 2007, and I was there for basically 7 months, working and studying acupuncture. So I was able to learn advanced techniques from some of the top acupuncturists that were in China. So I was there 2007, 2012, and 2018.
Okay. All right. And so you own your own medicine clinic outside of Chicago. How long have you owned your clinic?
Oh, geez, I've owned my clinic since pretty much the day after I graduated. So I basically always knew that I wanted to go into business for myself. I don't do well when I work with other people. I guess you could say I don't play well with others. So I decided, I'm going to open my own clinic. I started in my home in one of my spare bedrooms, and it just grew and grew and grew. Now I have about a 4,000 square foot integrative medicine clinic. So we offer, acupuncture, massage therapy. We offer therapy. We also offer, we have a nurse practitioner working here. So she does basically more Western medicine, trying to integrate Western and Eastern medicine together. We do functional medicine. So we do a whole bunch of different types of medicine here, but we kind of work together with Western medicine because we believe, one medicine doesn't have all of the answers. A lot of times when we work together, we can basically heal a patient's body more optimal.
Okay. Now, let me ask, with acupuncture, would it be able to help with like, like cancer patients?
Absolutely, yes. So I studied at MD Anderson Cancer Center at the University of Texas in Houston. And there they employ, I want to say at the time, so this was 2014. So I want to say at the time they employed at least, I believe, 20 acupuncturists there. And it doesn't cure cancer. So we always have to let patients know that it doesn't cure cancer, but it can help the body fight cancer. So it helps build the immune system. It helps if you're getting chemotherapy or radiation and you're having things like nausea, weight loss, insomnia, depression, anxiety, all of those things acupuncture can help with. And when you feel better and you're going through your cancer treatments, it's easier to fight cancer as opposed if you're feeling all of these different things and all of these different symptoms. If you feel a lot better, then it's so much easier to help to fight it.
Okay. Can I ask what made you decide to get into acupuncturist, the field? What made you decide to get into that field?
Yes. So I basically was rear-ended by a semi truck right outside of Chicago. It was an 18-wheeler. It had a full load, and I was sitting at a stoplight. And I saw him coming. I could look in my rear view mirror, and I saw him coming. And the first thing, it happened within, but I felt like it was a good hour because all of these thoughts were going through my head. I was thinking, what did I do? I see him coming for me. He's not slowing down. Is this road rage? Why is he going to hit me? Then the next thing I remember is that I was coming to, and there were people surrounding my car, and they were saying, "Ma'am, don't move, you're okay, don't move." And at the time I didn't feel anything, and I'm thinking, okay. But the funny thing is that I had just bought 4 brand new tires on my car. So that's the only thing I was worried about because the tires were really expensive. So that's the only thing I was worried about. I was like, my tires, are they okay? And everybody was like, "Ma'am, your tires are okay. You don't move." When the paramedic came, he said, "Okay, I'm going to have to get you out of your car." And at this time, I didn't know I had any injuries. He said, "I'm going to reach around you. I'm going to unbuckle your seatbelt. And then I'm going to put my arms under your legs and I'm going to scoop you out." And I'm like, okay. As soon as he reached around me, he unbuckled my seatbelt. As soon as he put his arms under my legs, pain just shot up and down my body. And I screamed and I'm like, "Don't touch me, don't touch me. It hurts, it hurts." He said, "Ma'am, we have to get you out of the car." And then I passed out from the pain. But what had happened was, how you have the seatbelt on and the bottom part of the seatbelt has, it keeps you secure in your seat. But the top part that crosses, it kind of has that give so you can kind of move. Well, when he hit me, he didn't even slow down. Basically, what happened is that this was the year 2000. So this is before we had, Google Maps and all of this stuff. And what he had done was he looked down and he saw the light was green. He looked down to look at his directions to see, if where he was making his delivery was nearby. By the time he looked up, the light was already red and I had already stopped. So that's how he hit me. But when he hit me, he was going at least 45 miles an hour, and it snapped my pelvic bone in half, the seat belt, basically. My spinal cord was also fractured. My spinal nerves were stretched. I had bruising on my ribs. I had a concussion and I had whiplash. But it was ironic. None of this stuff I felt until he started to move me, and then the pain just shot up and down my spine, and yeah, so nothing was actually able to help me. Nothing. I went through physical therapy, everything, and I was in the hospital. I want to say for like a good 2 months, and there's no way to heal a broken pelvic bone. Basically, just have to lie still. So, when I finally got up and started walking, I would walk bent over. And it felt fine to bend over. But once I tried to straighten up, that's where I had a lot of pain because the gravity was pulling on my spinal cord and kind of how the spinal cord stacks on top of each other. It just caused too much pressure. And basically, my doctor said, well, this may be something you have to live with. There's not much more we can do. And that's when someone suggested acupuncture to me. And that's when I started becoming really fascinated with it, because that was actually the only thing that helped me. Even my doctor, when I would go back for my exams with him, he would say, whatever you're doing, keep doing, because this is the only thing that's working there. I told him it's acupuncture, and he was just like, wow. He goes, okay. Then he started taking notes and everything. So, yeah.
And so, do you still do acupuncture today?
I do. Not for that though, because I know, and I know all the things that acupuncture can do and to benefit. It's great at reducing stress. I use it more or less just now for wellness and to stay healthy, and especially when COVID was running rampant, and to help boost my immune system. Yeah, so, and we were allowed to stay open in Illinois because we were considered essential. So I had to make sure I was getting acupuncture at least once a week, just to keep my immune system strong.
Okay. Now, I know that you mentioned about fibroids and everything. So, like the hormones and
Yeah.
fibroids, how does it help with fibroids? So, like, would this be kind of like another option rather than a lot of women go through having to have the oh my
Yeah.
God, what is the word?
Surgery. A lot of women I
You
know
have to
that
have
come here. Yeah, they have to have the fibroids removed, because especially if they're really big. Now, if they're really big, then it depends on how big they are. Then we would probably suggest surgery, because it take us too long to shrink them. But if they are, smaller ones, and if some women have several small ones that are kind of built on top of each other, then yes, acupuncture can definitely help shrink fibroids, cysts, things like that. Yeah, acupuncture and even Chinese herbs can help too as well.
so like, but it, like you, so if they're so big, it wouldn't stop you from having to have the hysterectomy. Is
Correct.
the word that I was. Okay. Oh, all right. All right. And so you mentioned too that you plan to open up a second medicine clinic in 2023. Of course, that was last year when we set up this interview. So have you succeeded yet?
Well, I'm in the process. I'm definitely in the process. We did find a space, so I'm just waiting to kind of finalize the build out. So, there's specific rooms that we want facing certain areas, and the number of rooms. So they have to divide some of the existing rooms to make them small, so that we can have more treatment rooms. But I'm well on my way. I'm almost there.
All right, cool. Congratulations.
Thank you.
Now going back to the Chinese herbs, what Chinese herbs would you refer, and like what exactly do they do? Like as far as health wise, like I
So,
want to find something that can keep me healthy, like keep my body strong and immune system up and stuff like that.
absolutely, yeah. So there's specific Chinese herbs that are used for immune system and to keep your immune system strong. Those fly off our shelf here in the clinic. We have a lot of teachers that take them because they're around students that are always sick. We have parents who send their kids off to college with them. We have our cancer patients take them. I take them. There's specific Chinese herbal formulas that are used to help build the immune system. I take them, especially if I'm going to be around people that are sick. But Chinese herbs can be used for so many different things. So like ephedra, let's take ephedra. And a lot of people will remember ephedra. Ephedra is basically a Chinese herb. But unfortunately, once it got into the hands of Americans or people in general, they figured out, ooh, this will help us lose weight. So they started using it in pills and started putting it on every weight loss package. This has ephedra, you know. But then people started getting greedy and started taking way more than what they should have. And it caused people to have heart palpitations, things like that. And so they banned it. The government banned it. The FDA banned it, but they also banned it from Chinese medicine doctors. And we never used it for things like that. We always used it for asthma because it works great for asthma. And it's actually called makwan. It's a Chinese herb called makwan, but it's called, Americans know it as ephedra. So unfortunately, they took it away from everybody. So we can't even use it for our asthma patients. And wouldn't you know it, the FDA is now using it in an asthma medication. So we're like, that's not fair. You know, you take it away from us from using it for asthma, but, you know, pharmaceutical companies can now use it for asthma. So, yeah.
Okay. All right.
But herbs do a lot of great things. Chinese herbs, most actually people don't realize it, but most Western medicine are made from either Ayurvedic herbs or Chinese herbs. So.
Okay. All right. And so using integrative medicine for infertility pause.
Yes. Yes. So we do specialize in women's health. So we see a lot of women that come in for fertility issues if they've tried to conceive and they're not having any luck. Lots of studies on how acupuncture can help with that. Even if patients are doing IVF, getting acupuncture to help their chances of getting pregnant. I believe the statistic now is it can boost your chances of getting pregnant with IVF anywhere between 50 to 80%. So those are good statistics right there. But women going through menopause, you know, reducing hot flashes, helping balance hormones like that. We have women that come in who haven't had a menstrual cycle for many years, you know, things like that. So it's really interesting, all of the things that acupuncture and Chinese herbs can do.
So, okay, you said it helps with women in infertility. What about men? Would it help men if they were the ones who, you know, had the issues?
Absolutely. Yeah. So a lot of times for men, it's, you know, what is their sperm count? You know, are they making enough sperm? You know, things like that. So yes, absolutely. We can help balance men's health hormones. You know, what is their testosterone doing? Is it too low? So we can help definitely balance men's hormones and help them too. It depends on everything what's going on. So usually what we do is we order blood tests. And our blood test can kind of help us see a little bit more of what's going on, whether it's female or male. What are their hormones doing? Is this something that we need to kind of help with?
Okay. Now, when you're doing the acupuncture, because I know it's like you're sticking the needles, you know, wherever on the body. Do you numbing people before you do that?
No, we don't, because you don't feel it really. I know a lot of people think of it as a
really.
Yeah, people think of it as, you know, like they're getting a shot or something like that, when really it's so tiny. It's like a hair. It's so tiny. And we're not putting anything in the body, not rubbing anything on the skin. It's just a solid thing. So basically what you feel is the needle break the skin barrier, because that's where all your sensory nerves are. But once it's through the skin barrier, people are so surprised. They're like, that's it? that's it. I don't feel anything. That's it, you know. And so I've actually even had patients that have come to me and they have needle phobias. So I'm kind of like, I don't know if this is going to be the best medicine for you, but they do it, and they're like,
That's
you know, because they're like sweating all over and they're so nervous and they're like, and they're hyperventilating. It's like, okay, we'll just try a couple of them. And then they're like, that's it. That's it. So yeah, it's nothing like what people think.
yeah, I'm like one of those people that has needle. Like even right now, today at 50, if they want to give me a shot or put an IV in, I'm just like, it takes them about 10 minutes, and I'm like a little kid, like. So
I understand.
yeah.
Yeah, I understand.
Oh, okay.
But the thing is that so this is so tiny. People look at the needle and they're like, "That's it." You know, that's so tiny. So yeah, you don't feel anything. It doesn't bleed when it comes out. People are so amazed.
So how many needles do you put in, a person at one time, and like what's the length of time that you would like, do the acupuncture?
Absolutely. So the amount of needles will depend on what's going on with the person. So there are over 300 actual acupuncture points on the body, but then there's also about 100 or so extra acupuncture points. And then there's so many different acupuncture points. I would say there could be at least probably every surface of the body is an acupuncture point at some.
Lost sound. You lost sound. You lost sound. No, I don't know. For some reason, the sound went out. Are you able to hear me? No, still can't hear you. No, I don't know what happened to you. But you're able to hear me though, right? You can't hear me? Let's see. Can you hear me though? Are you able to hear me? Okay, so then I'm maybe try going out and coming back in. Give us a second. We're trying to figure out what happened with her sound.
Can you hear me now?
All right.
You hear me?
Yeah.
Okay. I don't know what happened.
Yeah, I can hear you. I don't know what happened.
Well, we
Your
can.
screen went black, and then when you came back in, your sound wasn't working.
Okay.
Okay. So, what were you saying?
um, of course I forgot.
I
But
think the last question I asked was like, was there a length of time in a certain amount of needles that
yeah.
you would use?
Oh yeah. So definitely, I've worked with athletes. I've worked with some of the Chicago Bulls. I've worked with a couple of the Chicago Blackhawks, our hockey team here, and they tend to want more needles, even though they don't necessarily need more needles. Sometimes people think more needles are actually doing them better, but that's not necessarily the case. And then I've worked with some people where I only do 4 or 5 needles. So it just really depends on what's going on with the person.
Okay. Now you just mentioned that you work with a lot of athletes. do you find yourself working with a lot of athletes that's torn their ACL? Because that's kind of like one of the number one things that happens to athletes is they always tear their ACL.
Very true. Very true. Yes. ACL, knee injuries, rotator cuff injuries. Yes, definitely. You know, acupuncture can help.
And so,
I'm sorry, go ahead.
what were you going to say?
Oh, no, I was just going to say that
I,
everybody knows acupuncture to help with pain. Most people don't realize the broad spectrum of acupuncture, everything that it works for. So, you know, pain is the number one thing that people come in for. So, yeah.
And so you would more or less refer this versus like pain pills, and
yeah,
would this be like more of a better outlet? Okay. All right. All right. And so then in the accident, you were paralyzed?
I wasn't paralyzed. Everyone thought I was paralyzed, but I wasn't paralyzed. I just couldn't feel anything. And then slowly everything started coming back. The feeling slowly started coming back. And they basically had to kind of teach me how to re-walk again, things like that. But yeah, I wasn't exactly paralyzed, which was good.
Do you still... Yeah, that's a good thing. Do you still travel to China?
You know what? So I haven't been to China in a while, and I'm not sure how soon I would be going back. Just because our relations in the U.S. and China aren't that good right now. So, you know, I always tell people I don't want to end up like Brittany Griner and, you know, be put in jail for some stupid reason, you know. So
yeah.
I'll stay here for a while, although I am going to Africa in May. So I'm excited about that. So I'm broadening my horizons on China.
Okay. All right. So would you like to tell people, you know, where they can find you? I know I did put your links in the description, I believe. So would you like to share with people where they can find you?
Absolutely. So we do work because we also do medicine. We can work with people no matter what state they're in. We can order blood tests. A lot of times we order blood tests that Western medicine will not order. So we can dig a little deeper. And a lot of times that's where you find things. That's where you find you know, what's really going on in the body. And unfortunately, we have people that come to us and they say, you know, I don't feel good, but my blood tests say that I'm normal, but I know there's something going on with me because I just don't feel good. That's because normal is not optimal. So just because it says you're normal, you could be on the high end or the low end of normal, and your doctor will tell you that you're normal. If you're on the high or the low end of normal, you're just about to jump into dysfunction. So that basically means that your body is struggling to pull you more back into that middle state. And so we always tell patients, be aware of that, you know your number. So we can work with people all over the country. So again, we will order blood tests and kind of go over the blood test. We'll give them, you know, diet ideas. We work with pharmaceutical grade supplements here. So we can ship out supplements for them, things like that. So yeah, definitely we can work with anybody, no matter where they're at. But we are basically called the Emperor's Medicine. Our clinic is called the Emperor's Medicine. One of the reasons why I call it the Emperor's Medicine is because a long time ago, the emperors thought acupuncture was the key to help them live forever. So nobody was allowed to get acupuncture, only the emperors. And they made all of the doctors burn every single document or anything that they had about acupuncture. They made them burn it. But some of them were smart and they went far away and they would bury them. And those are actually the books that we study from today, are the things that they've dug up. And so, you know, those, and they wouldn't even allow women to practice acupuncture. So being that it's International Women's Month, this is like perfect because they wouldn't allow women to practice acupuncture because they said women would go tell all their friends and family, you know, all of the secrets about acupuncture. So I always say hats off to all the women acupuncturists out there because, you know, we do phenomenal work, I guess you could say. But so yeah, so that's why I call it the emperor's medicine, because if it's good enough for the emperors, it's, you know, if it's gonna, obviously they didn't live forever, but you know, it's remarkable medicine. So the emperor's medicine, we are at the we're at the emperorsmedicine.com.
Okay. All right. And you can also be found on Instagram as well. Or no, it was YouTube and Facebook, correct?
Yeah. We're having a little issues with our Instagrams. We'll get there, but yeah, Facebook and YouTube, we have a lot of that. So
Okay. Well, it was a great discussion, and I thank you for the opportunity. I look forward to more in the future.
Thank you.
You're welcome. All right, and you have a good evening. Thank those who tuned in. I have one comment here. I think somebody said ACL is at the top of the list. Yeah.
Yes,
all right. Thank you guys. You all have a good evening.
Bye bye.
See you later.
Thank you, Yolanda.